Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Today on the podcast, I'm talking to GP Dr Callum Leese about the importance of physical activity and how primary care professionals can promote it to their patients. Callum is a GP in Aberfeldy in Scotland, and he's also the Royal College of GP's co-lead for physical activity. In this conversation, Callum talks about RCGP initiatives like the Active Practice Charter and parkrun practices and how these can benefit both patients and staff. He offers lots of advice for GPs on how to raise the issue of physical activity in consultation and discusses the importance of tailoring exercise advice to patients with specific health conditions. We also talk about a really fantastic initiative he's involved with, which is aiming for his hometown of Aberfeldy to become the healthiest town in Scotland, as well as his work with the British Society of Lifestyle Medicine, where he leads the Physical Activity Special Interest Group. This episode of Talking General Practice has been supported by Dexcom. Season 2 of Dexcom's podcast Diabetes Dialogues is here, and they'll be discussing type 2 diabetes. New voices, fresh insights and real conversations you won't want to miss. If you haven't heard of Dexcom, they've been developing continuous glucose monitoring systems for over 25 years, empowering people living with diabetes to make informed decisions and improve their glycemic outcomes. And Dexcom has more level 1 evidence than any other CGM brand. This season, Dexcom are inviting expert healthcare professionals to share fresh perspectives, challenge conventional thinking, and open up meaningful conversations about how we care for people living with type 2 diabetes. The podcast will dive into the most relevant topics in this field with a whole host of guests, including approaches to management of type 2 diabetes with Dr Wakas Tahir, the guidance, NICE, SIGN, ADA, EASD and What's Next with Dr Jackie Elliott, type 2 diabetes and technology with Professor Sam Seydoux, and the future of diabetes, as well as much more. These conversations will challenge your assumptions and develop your understanding of the complex management of type 2 diabetes. Listen and subscribe now so you never miss an episode that helps you deliver better care every day. The Diabetes Dialogues podcast has been created and fully funded by Dexcom UK and Ireland and is intended for healthcare professionals practicing in the United Kingdom and Ireland. I'm really pleased to welcome onto the podcast Dr Callum Leese. Callum is a GP in Aberfeldy in Scotland and also works at the University of Dundee. His research interest is in physical activity and specifically physical activity promotion and implementation in primary care. He's also involved with the British Society of Lifestyle Medicine, where he leads their Physical Activity Special Interest Group and a co-host of the Movement Prescription podcast. Thanks for coming on the podcast, Callum.
Thanks so much for having me. I say it's funny being on the other side of the microphone, so hopefully I can do it justice.
I'm sure you will. So I mentioned at the start there, your research interest is in physical activity and physical activity promotion. How did you get interested in this area?
I've always been passionate about physical activity. As a kid growing up, I kind of played every sport under the sun, really. I had a very privileged upbringing from that perspective. Thought about doing sports medicine, and I did an integrated degree in sports medicine at uni. And then kind of drifted away from it for a number of reasons. But during COVID, I was struck by just the number of non-communicable diseases that we were seeing that were not directly linked to COVID, but more related to lockdown, and particularly how we address that. How do we help people overcome barriers? I felt it was probably a bit too ambitious to try and tackle them all. So I thought, well, why don't I try and kind of combine my passion with physical activity and sport with a kind of public health lens to try and address physical inactivity, and particularly within my field of work, which is primary care.
Are there any research projects you're currently working on?
On the back of the research, I've got involved with the Royal College of GPs, so I'm their physical activity and lifestyle lead. And through the college, we've got a couple of things that we do. So we've got the Active Practice Charter, which people might have heard of, which is an award for practices that are delivering physical activity promotion to patients and staff. And we've also got parkrun practices. And so we've done a couple of recent pieces of work exploring both of them. Really, they were kind of preliminary pieces of work. They have been published, but actually the main bulk is ongoing. And so we've managed to get some more funding to keep doing kind of further exploration of those pieces of work. There's a few other bits and pieces. I did a bit of work at the WHO and we just done a piece of work looking at physical activity promotion in policy in every country in Europe. So that was quite interesting as well, comparing and contrasting.
What were you doing when you worked with the WHO? Was it that piece of work?
Yeah, it was. It was actually my GP training. It was back in 2023, Emma, and I basically just was exploring opportunities, and this one came up, and I'm immensely grateful for them letting me to go and pursue it, both from the WHO but also from the deanery I was in. And I headed over and spent a couple of months in Copenhagen, which is where the WHO office for Europe is, and basically did a bit of analysis on a data set they had. And it was really interesting. I think a lot of countries are doing some things. A lot of countries have that introduced in policy. About 2/3 of countries in Europe have policy around physical activity promotion in primary care. I think there's often a policy, what we call a policy implementation gap. So although the policy's in place, I think whether or not the practitioners are actually delivering that policy is challenging. And I suspect there is a gap there. And that's probably the next piece of work, is to explore how well that policy is being implemented.
When we're talking about sort of promoting physical activity in primary care, why is it so important? And what does it actually mean? Is it just about bringing it up in consultations?
Great question. I think it can mean a lot of different things to a lot of different people, and I think that's where it becomes confusing. And so, first of all, you've got the promotion aspect, which might be exercise referrals, it might be counselling, it might really just be advocacy. And so, I think the exercise referral schemes are pretty well established now. Counselling, I think, is a bit tricky, and my experience personally within medical school and postgrad training is that our education in behaviour change is probably a bit limited, and so that can be tricky. For me, it's really just about advocating for physical activity. So whether that's mentioning it as part of management plans, whether that is doing referrals if appropriate, or whether that's just showing people that it's something I'm passionate about, having my standing desk up, having the bike helmet on the hook, whatever it might be. I think the other thing is, what is physical activity? That's a really tricky thing, because there's so many different things to different people. Maybe it's walking, running, which is amazing, but that adds layers of complexity, doesn't it? Because it can be tricky to recommend something that can be quite vague, but that gives us opportunity.
You mentioned that you're the RCGP's physical activity champion. So what exactly does that role involve?
I do it with a colleague and friend called Hussein Al-Zubaydi, who is fairly well known. I basically copy Hussein, follow him around thinking, gosh, what does he do? I should do it too. No, it's really an advocacy piece, Emma. So what we're trying to do is really a few things. The first is to try and encourage our colleagues in primary care to deliver physical activity promotion. The second is to make it easier for them by delivering teaching and resources. And so we've just updated the Physical Activity Hub toolkit, which you can access by Googling RCGP Physical Activity Hub. The kind of third piece is advocating at a wider level. So talking at conferences or speaking to leisure providers about the role that primary care can play.
You've also mentioned the Active Practice Charter. That's a big RCGP initiative. What does that involve? So if practices want to sign up to that, what does it mean for them practically, and what are the benefits of doing so?
What we ask them to do is to submit an application which proves 5 things: that they're addressing staff physical activity and sedentary behaviour, patient physical activity and sedentary behaviour, and then the 5th one is partnering with a local physical activity provider. I think about 72% of all active practice charters are partnering with parkrun practice, so that the parkrun practice is kind of a first step towards the active practice charter. But there's a range of other organisations. Some people have set up walking groups, run talk run or walk talk walk. There's quite a few practices that do things like that. And so the options for partnering with a physical activity provider are kind of endless. They're the 5 things we ask people to do. In terms of what are the benefits, I think the certificate can be useful for things like CQC. We're actually doing a piece of work at the moment looking at if there's any correlation, I stress that word, correlation, between having an active practice charter and your staff and patient wellbeing score for the practice. That's not done yet. I don't know what it's going to show, but that would be really interesting. But the other thing that we have looked at is one of the major outcomes we've noticed from the preliminary research that we have done is that the active practice charter and the parkrun practice both seem to have an impact on staff morale and well-being. I think that needs to probably be thrashed out a bit more. What exactly does that look like? It would be really amazing to see if we could find any link between retention and sick days, because you can make an economic argument, which would be much more powerful. Personally, when I go to parkrun, it's just amazing. It's so nice going along and just meeting like-minded people on a Saturday morning. The energy in which is definitely uplifting. In terms of the practices, I think it totally varies practice to practice. One of the challenges is that if you partner, it can look like loads of different things to different practices. And so some practices are really engaged in parkrun. Some practices just have a poster in the waiting room and are a lot less engaged. And actually, the scheme is designed to allow for that flexibility. But it feels like the practices that are more engaged gain more.
Do you go along with your patients as well? Is that part of it?
Yeah, definitely. I think that's the advocacy piece, isn't it? Is seeing your local health professional at the parkrun and practicing what they preach.
You said it can be quite challenging, like talking about physical activity. So what advice would you give to GPs or other healthcare professionals listening to this about raising the whole issue of physical activity in consultations? What's the best way to approach it?
Finding a balance between trying not to have any blame or attributing any guilt is a challenging thing. And so my one piece of advice would be go to the Moving Medicine website. That's produced by the Faculty of Sport and Exercise Medicine. Just put Moving Medicine into your browser, and they have got loads of, they call them consultation guides, which is basically conversation openers about how to bring up physical activity for general conditions, but also for specific conditions. So maybe an opener for diabetes. Did you know in diabetes that physical activity can be really helpful in both managing but also treating the disease? So things like that, there's loads of them. It's really helpful. It just gives a bit of an indication of how to bring these topics up in conversation.
Yeah, and I mentioned your podcast at the start. I mean, that's very much about this sort of thing, isn't it, really? About how you kind of incorporate physical activity into a health setting. How did the podcast come about?
We did a bit of work with some GP trainees here in Scotland and was not surprised, but it definitely reaffirmed my experience, which was that I felt significantly undertrained in delivering physical activity promotion or behavior change generally. There was a piece of work done in 2013, I think, that showed that the average length of time spent over 5 or 6 years of medical school teaching about physical activity was about 4 hours. There was another piece of work which showed that the dial hadn't shifted. And so we get very little teaching in physical activity. And as GPs, to my mind, a bit of an expectation that we should be delivering some kind of physical activity promotion. There's evidence that we can do it and be successful in doing it, but it's not happening. And so one of the major reasons for that, alongside time, which sadly I can't fix, but was knowledge. And so the hope was to deliver a podcast just to see if we could help people upskill to deliver these conversations.
Some of the episodes of the podcast, they really focus on specific conditions and how you can incorporate exercise and movement into managing those conditions. I mean, how important is it to tailor advice on physical activity to individual patients and, their circumstances and why they've come into the surgery to see the GP?
Tailoring is really important. I've recently done a piece of work around chronic pain with some colleagues, and one of the things that people really want is tailored advice to their chronic pain. The kind of generic advice about being more active, people think, well, I kind of get that, but what about me? What about my condition? The biggest barrier to people being more active is often their pain or their comorbidity, whatever it might be. And so unless we speak into that, then we're much less likely to be successful. When you're in pain, that's one of the things that is really important to hear, is that actually, am I making this worse? And in some cases you might be, and that where it's important that people have the knowledge to speak the right advice. But often in a lot of cases, people need reassured to say, work in the soft edges of pain. And actually, I don't profess to be an expert in many things at all. My biggest attribute is enthusiasm. But the great thing about physical activity and comorbidities is that there's so many other resources available out there. And so often when we've talked about specific conditions, we've always brought in experts to interview, but they often have resources. So maybe it's the Active Pregnancy Foundation, Age UK, whatever it might be. There's loads of organizations and bodies out there which have the resources, and sometimes it's just a bit overwhelming. I think this is probably the case in all walks of life. You don't really know where to look, and so hopefully we can point people in the direction of a starting place.
All the research says it's really important to be active, particularly as you're aging, but Is there a gap between what the research tells us is effective and what's actually achievable for the average GP in a 12, 15-minute consultation? What can GPs do about this when they're talking to their patients?
I think that's one of the really challenging things is being realistic in this. How often do I bring up physical activity? Hopefully a couple of times a day. Do you know, I'm not doing it with every patient. I was recently asked to host a medical student for an elective in lifestyle. And I kind of said, they're just going to think I'm a total fraud. Do you know, I don't do this very often. I say that because I want to be realistic about the fact that this is really challenging. Your time is so pressured and choosing moments where I'm lucky where I work, which is quite rural. I've got to know a lot of patients quite well, and a lot of this has kind of happened over time, or conversations I have done have happened over time. And probably the biggest thing that causes conversations about physical activity is my standing desk, because I leave it up during my consultation and I sit down next to the patient, and they'll often either walk in and say, "What is this?" Or when I ask permission to stand, they'll ask a question. And so that's the biggest prompter of conversations. And actually it's quite nice because it comes from the patient as opposed to from me. The other nice thing about that is I feel it removes the screen. I found that often in primary care, you kind of have like a screen between you and the patient. If the desk is high and you're sat down with the patient, then that digital interface is removed and it feels much more human. I accept that you then have to type your notes afterwards, which can be a bit frustrating because often it's during coffee time for me.
Continuity of care. We're in a rural area, you know your patients really well. Surely it must be easier to have conversations about lifestyle change, about physical activity, if you know your patients really well. Do you think that has a role to play in how we can do this better?
Yeah, hats off to colleagues that work in places that are exceptionally city centre practices, for example, that don't have continuity of care, because it definitely makes my job better in a range of ways. The other thing that working rurally, it slightly forces your hand because you need to live in the community in which you work. And so you become a recognised face. That therefore forces advocacy or makes you a hypocrite, one of the two, doesn't it? Hopefully it's realistic. You know, I think people see me going for a run. You know, people see me buying chocolate or wine in the shop, and actually I don't mind. That's real life, isn't it? It's being involved in the community aside from just being a GP.
Are there any findings in research of physical activity that might surprise the average GP? Do you think GPs have a good understanding of what they should be recommending to patients in terms of exercise?
This is something that the digger you deep, the harder it can be. And I think, for example, if someone comes in and is asking intimate specifics about exercising in pregnancy or in kind of quite niche conditions, that can be quite hard to know exactly what to say. The kind of tagline stuff, you know, the 150 minutes a week. Again, I'm not sure how helpful that is on an individual basis, because if you're achieving 150 minutes a week, you still have benefit from doing more. And if you're only managing 5 minutes a week, then 150 minutes a week seems quite alienating and quite a long way in the distance. And so advising a little bit is really important. In terms of surprising findings, to be honest, there's a lot more research needed, is the bottom line. I think there's a lot of evidence which shows the potential and the power of physical activity. I think there's a big gap between what could happen and what is happening. And so how do we close that gap? And most importantly, from a primary care perspective, unless you give us more time, how are we going to address this? And so do we need to think laterally? Is it about having physical activity coaches? Is it about altering the environment? What we can't keep asking is more and more time from GPs and practice nurses and practice staff more generally, because that is just not something that we have.
You're involved with an initiative in the area you live, Aberfeldy, called The Healthiest Town. What exactly is that, and how did that get started?
It kind of started on the back of this journey of exploring how we address some of the non-communicable diseases spike we noticed in the aftermath of COVID. What we wanted to do was reduce as many of the barriers to healthy living as we could within our local community. And so we kind of had this slightly wacky idea of, well, why don't we try and make our town the healthiest town in Scotland? And so we set up a charity. We now have a few staff that work. We've got a project manager, a kind of communication, I think officer's probably a bit grandiose, but someone that puts out lots of social media stuff. And we had a health coach for a while. Sadly, uptake wasn't what we hoped. So we had to pull that funding. But what do? We basically host events in the community. So we've been hosting things like a community ceilidh, talks in the local town hall. We've had food festival for 2 years in a row now, which has gone really well. We are engaging with local primary schools. And one of the local primary schools has got a market gardening and some growing. And also what I love, and this is not from us, this has come from them, but in the final year of primary school, they have prefects. I don't know how routine that is. It happened when I was a kid, but kind of prefects in the final year. And they've removed houses and have pillar leads. So they have like eat well or eat real food, move more. What an amazing way of kind of engaging the kids in healthy living. A range of things that kind of just touches probably the tip of the iceberg, really. But will we ever know if we're the healthiest town? I don't know. And to be honest, I'm not sure that's the point. I think we just want to aspire to be, because we can always be healthier in some way.
What's the reaction to your patients about that? How does it affect your consultations as a GP in the town?
It's fairly detached from the work we're doing in the practice, and that's slightly intentional. We want to kind of take health out of healthcare into the community. It's often not brought up unless by me in consultation, if I think there's something that might benefit the patient, like cooking classes, for example, which we have run. But often I'll see patients at events. Yeah, it kind of often works the other way around, but that's just nature of kind of living and working in the same community. One of the joys of kind of having a bit of a knowledge of the community is, I've been able to, for example, recommend the men's shed, and I know when it runs, so I can speak to people that directly about that without necessarily having to involve the social prescriber, so that there's an element of that involved in what I do. But I think that's pretty routine for all GPs, to be honest.
You're involved with the British Society of Lifestyle Medicine. Obviously, physical activity is really an important part of lifestyle medicine. How do you define lifestyle medicine, and how does it fit in with the traditional GP model?
Lifestyle medicine is a really kind of interesting field. It feels like it's expanding in some ways. I think the most important thing for me is in the definition. It starts by saying it's evidence-based specialty. So I think we need to be really clear that everything we talk about when we're talking about lifestyle medicine should be evidence-based, because I think there's sometimes things happening in the periphery that might not be, and we shouldn't let that discredit what we're trying to do. And basically what it is, it's an evidence-based specialty using behavior change techniques to try and improve patients' lives. And it's based around 6 pillars of lifestyle medicine. So as you mentioned, physical activity is one. Nutrition is a second. Sleep, healthy relationships, mental well-being, stress reduction. I think that has a few different phrases sometimes. And the 6th one is limiting harmful substances. So that's the kind of 6 pillars. That's probably what most people have heard of. From my experience, is looking at how we just integrate this into our day-to-day conversations. And actually, I suspect a lot of people are doing it anyway. This is what we talk about, a lot of these things, when we have someone with high cholesterol, high blood pressure. And it's just formalizing that, or having training in that to deliver it hopefully as well as we can.
Does that help in patient consultations when you sort of say, well, you really should do a bit more exercise, or you really need to, cut this out? Does it help having that knowledge that you learn from being involved?
Yeah, I think so. I've definitely benefited from that. And the other thing I've benefited from is not only having the knowledge, but also being able to share some of that. So saying, well, maybe you should look at these resources, or if there's someone that's really wants to read up more, I'll even share papers with them if they're interested. And the number of times I've recommended Chris Van Tulken's book, Ultra Processed People, to patients. And actually I've had loads of people write back to me or say, I've really enjoyed that. Thanks so much. So that's been really nice. And it's nice to have these things that you can recommend to patients.
You recently ran a session at the RCGP annual conference on lifestyle medicine and sustainability. What was that all about?
What I've realized about lifestyle medicine is that so much of what we do also impacts sustainability. So we're trying to encourage people to walk more or take their bike places, and that might involve dropping the car. We're trying to encourage people to eat more veg, because we know that eating veg is good for you, and that has an impact on sustainability as well. If we're cutting back on alcohol, we're cutting back on smoking. All these things are the sustainability message, but from a different perspective. And so the title of the talk is Why Lifestyle and Sustainability Are Different Side of the Same Coin. And so we're basically trying to tell a story around the fact that both are really important, both sit hand in hand. What we would love is GPs to be mindful of that when they're having consultations. And actually, some people you might hit with the sustainability message and acknowledge that it has an impact on lifestyle. Some people you might hit with the health and lifestyle message and it has an impact on sustainability. It actually doesn't really matter. And then the other thing we're planning on touching on is a bit about health equity in there as well, because one of the biggest challenges here is that health equity bit, in that for both lifestyle and sustainability, one of the things that's leveled against it is this not just what wealthy people are doing. This is the prerogative of the wealthy. And actually, what is really interesting is actually the people that will benefit the most from it are people often that are the most deprived. They often will feel the impact of climate change the most, whether that's globally or even here in the UK. And often it's people that are, struggling day to day or financially don't have the money to buy avocados or whatever it might be that we'd love to reach to try and support the most from a lifestyle perspective. And so I think we need to be really intentional, really honest and open about that and trying to address that as well as we can.
Physical activity is obviously not just important for physical health, is it? Like, it's really important for mental health as well. And you mentioned them earlier, but you're involved with the charity Run Talk Run. Can you explain a bit more about that organisation and what it does and how you're involved with that?
Yeah. Just before I jump into there, one of the things that I've kind of been interested in recently is our messaging around physical activity, because when we talk about it, we often talk about the long-term benefits, but actually, I'm not sure how well they land. I think maybe it's much more pertinent to talk about the short-term benefits, the uplift in, well-being, the friendships we can gain. When we talk about things, if we focus on the short term, then the mental health becomes much more pertinent. And Run Talk Run is a charity which I think it was set up about 2018, but it was basically set up as a mental health support group primarily, acknowledging the power of physical activity in that it involved a 5K run. There's now also Walk Talk Walk, which is exactly the same concept, but for walking. And basically it's just an open space for people. So we meet after work on a Monday evening at the local school, which is just across the road from the practice. We basically meet, we have a quick introduction for people that haven't been there before, and then I ask everyone to rate how they're feeling out of a score of 1 to 10. So 1 being pretty poor and 10 being as good as they can imagine. And if they want to justify their score, they can. Otherwise, they can just lay the score out. We do a warm-up and we go. And the power of that score is it's a starter for conversation. You said you're 5, Joe, do you want to talk about it? And if people don't, that's fine. We just go for a run. That's the concept. And there's about 190, I think, in the UK now. So yeah, it's really worth checking out their website and seeing if you can either partnership with one, or if there's not one locally, why not reach out to me and we can see if I can help encourage you. Maybe not help that much. I'm a bit limited for time at the moment.
It's such a good point that, though, about the immediate benefits of exercise, because my husband's a runner and he does it as much, if not more, for his mental health than for the physical benefits that it brings, because he finds that just being outside and spending that time when he goes, it is just really valuable to his day-to-day well-being rather than thinking about the long-term benefits. But obviously he gets them as well, so that's good.
Yeah, it's a win-win, isn't it?
That's brilliant. Thank you so much for coming on the podcast, Callum. I really appreciate it.
Oh, thanks for having me. It's been such a delight to talk about all things physical activity and lifestyle.
Well, that's it for this week. Thanks again to Callum and thank you for listening. I'll be back next week with Nick for our regular news review, where we'll be discussing the increasingly bitter row between the BMA and the government over online access and all the other key stories affecting general practice. In the meantime, you can keep up to date with all the latest news on our website at GPonline.com.